Hey folks, Dr. Gerstmar from Aspire Natural Health. Good morning, good afternoon, good evening. Whenever you happen to be listening to this, I hope you're having a great day. Listen, today I had another insight from making a smoothie that I wanted to share with you all that I think is relevant to the things we're trying to do in our life and dealing with digestive and autoimmune issues, working to recover and restore our health. So I've talked previously about smoothies, the pros and cons, and whether you should do it or not do it. If you haven't listened to that podcast episode, I recommend you go back and give it a listen, as smoothies can be a good option for many people. All right, so obviously, how do you build a smoothie? You put in your ingredients into a blender and blend them up. Well, what's one of the things about a smoothie is that multiple ingredients go in. After all, I mean, what? If you just threw in oranges and that was it, what would you end up with? Pulpy orange juice, right? Not a smoothie. If you just threw in just broccoli, that'd be a pretty rough smoothie, right? That's not the whole point. The point of a smoothie is to combine multiple ingredients together to get the benefit of all of them in terms of taste, in terms of texture, in terms of health benefit, in terms of nutrition. A smoothie is built on multiple ingredients. Makes sense, right? But it's a key important piece. Now, when we turn to our health, we turn to dealing with digestive and autoimmune issues, we find there's a tendency, both in us as individuals and in the regular healthcare system, to want to just use one thing, right? Just go on this one medication or take, people, a lot of us, well, if I just do this diet, it'll fix everything. Or if I just take this herb or this supplement or this probiotic, or if I just do this one single treatment, that will take care of it. And there's two reasons that we tend to do this. From a medical side of things, it's what I call the engineer's mind. It's wanting to say, I do one treatment and I assess what happens, and it's very clear because I've only done one single thing. I've added this pill. And now what happens? Is there big improvement, little improvement, no improvement, or do things get worse when I do it? Aha, that change is because of that one treatment. It makes it much easier to know what's going on, to know how things are effective, to understand what's happening. And look, there is a place for this. Often in a person's treatment, we are changing one thing at a time and gauging what's happening for that person. After all, if you change 5 things at once and the situation changes, it can be hard to say, well, was it this one thing or this thing or that thing or 2 of the 5 things or 4 of the 5 things, or, what caused this change? So we have the kind of engineer's mindset of wanting to isolate each piece, make the change, and assess what happens. And of course, as doctors, we like that because it's much easier to manage, especially if we only have very short visits or infrequent visits, as is the case in the regular medical system. We need things to be as simple as possible so we can effectively manage the situation for people. Now, the second reason that we tend to do this one thing mindset that we're talking about is the desire for silver bullets. Now, it's important to understand we all have the desire for silver bullets. After all, isn't there just like a simple thing that's easy and straightforward that I can do that will immediately solve my problem, take away my pain, my symptoms, my issues? We see it everywhere, right? Whether it's a book promising that if we just do this one thing and just follow this simple, easy system, we'll lose all the weight we want, we'll make all the money we want, we'll have the perfect relationships that we want, everything can be solved, right? We fall for it, all of us, me too, all the time. And it's important to realize that our brains are grooved that way. We want simple, easy answers, but we know, right? I know, there are no silver bullets. Yes, in a few rare circumstances, if you have an infection and the right antibiotic can be chosen to treat that infection, then pretty quickly and easily that infection can be wiped out and a person can go from being on death's door to basically being healthy and normal again. Yes, those circumstances do happen. And the conventional system wants us to keep holding out that we're going to find those things for other digestive issues and autoimmunity and cancer and other serious issues. And the reality is we'll probably never see those. In very simple and straightforward issues, simple and straightforward treatments can work. But often, look, the reality is you're listening to this because either you or a loved one are dealing with digestive issues and autoimmunity. Unfortunately, most significant digestive issues and autoimmune disease, a single treatment just isn't going to work. So just taking a medication or just changing a person's diet or whatever it might be, hypnotherapy or an herb or whatever it might be, just doing one single thing is unlikely to give you the results that you want and to give you the long-term and sustained results you want. Yes, you can find that rare individual, who changed their diet and everything went away for them, or took a course of herbs and everything went away for them, and they've been great since. The reality is, after having seen many, many patients over the last decade, it is a rare thing indeed. Like a smoothie, let's bring this back around, we're going to need to combine multiple ingredients together to get the thing that we want. If we want long-term and sustained health, we want the symptoms to go away, we want our autoimmunity to be in remission, to be quiet, to not bother us. We want to feel great and to live that bigger and better life. We're going to need to combine multiple things together for taste, for texture, for nutrition, just like we're getting out of that smoothie. That's why a comprehensive plan, a holistic plan that looks at every piece of a person and that systematically goes through and ticks off the boxes to make sure that all of those issues have been done is the only way to really address the root cause of our issues. So, what can we take from this? This is something that a regular doctor with short visits and a kind of a narrow mindset of focusing on one body part at a time just is not going to be able to pull off. So expecting those doctors to be able to do this kind of care is just unrealistic. Maybe you find that 1 in a million doctor who can pull that off for you. But as we see over and over again, people trying to get this kind of care out of the regular system, feeling frustrated, angry, overwhelmed, upset because their doctors can't provide this kind of care. So you're going to need to seek out someone who is able to provide that level of care for you. The second is understanding that it is normal, it is natural, it's like a basic human thing to want silver bullets. We can't say, stop that. We all do it, right? But also understanding, bringing in our rational adult mind to recognize that when we want to lose 50 pounds overnight or when we want to deal with our digestive issues or autoimmunity, that a silver bullet approach just is not going to work for us. Instead, we need to recognize that it is going to be a process. It's going to take multiple steps. It is going to take time. It is going to take work. That's the reality of the situation. And if we don't want to do that, then it's better off not going down that route in the first place. If you want to make a smoothie, but you're determined to find the one single thing that you can throw in the blender to have a great smoothie, it's better off just not to make smoothies, to recognize that it's not the right approach for you. And similarly, if this idea of this holistic multi-step process to get to the root causes sounds, gosh, that's just too much work, too much effort, too much investment of time, money, and energy, just something that I don't want to do, it's great that you recognize that. It's great that your loved one recognizes that. Then stop, beating your head against that wall of trying to do it and then being upset that it is this approach, right? We need to recognize the reality of the situation, what our goals are, and what it is that we want to do. And any which way that someone decides is great. So when we make a smoothie is built on multiple ingredients. A proper and effective plan for the long-term care of digestive issues and autoimmunity is built on multiple components. If you are trying to put together a plan yourself based on doing one single thing, recognize that it's very, very unlikely that that's going to get you the results that you want. If you're seeing someone whose plan is based on doing one thing alone, recognize that it's very unlikely that that is going to give you the results that you're looking for. The proper care of digestive issues and autoimmunity involves multiple steps, multiple pieces, and that's how we get a smoothie on the other end that's not only delicious, has good texture and good nutrition, but helps us to get towards our goals. All right, folks, that is it for me today. Listen, if all this discussion of what effective care truly looks like, you're going, yes, that sounds like something I actually want to do, and I want to discover a practitioner who can help me do that, I want to invite you to contact us. Reach out, give us a phone call, send us an email, or drop us a message and say that this is something that you're interested in. If you're dealing with digestive issues and autoimmunity, if you're friendly, open-minded, and coachable, and now is the time, you're sick and tired of being sick and tired, and you're willing to do this kind of holistic approach, you're willing to invest some time, some money, some energy in finally solving these issues, reach out to us. What we'll do is we'll have a conversation. We will learn more about you, what's going on, we'll listen to you, we'll understand your goals and what the situation is. From there, we'll let you know if we are the right fit to help you, because we only work with people that we are confident we can help. If we are the right person, we are the right people, we will talk about next steps and see about moving forward. If we're not the right person, that is okay. We will do our best to refer you to the person who is the right match for you. You'll leave our call feeling calm and confident because you'll know what the next best steps are for you. Instead of just spinning your wheels, feeling overwhelmed, confused, or frustrated, you'll know what the next step is that you need to do. So all you do need to do is reach out to us. Give us a call, send us an email, or drop us a message, and let's arrange to have a chat. All right, folks, that is it for me today. Until next time, take care.